Every patient that we spoke to told us about feeling tired, fatigued, or like they didn't have as much energy as they used to. However, just to remind you, most of these patients had never been on treatment, so your experience may be different. Some patients also told us that they had pain or that they felt weak.
I remember being extremely tired, and I realized I'm an old guy anyway, but I thought I'm a little bit more tired than I should be after I've had a good night's rest. But like I said before, I didn't really feel sick, you know.
These symptoms made it hard for patients to do everything that they used to do.
I tried to have my normal life as much as I could. To go out, go for shopping, go to movies here and there. Unfortunately, I did not have that much energy. So I'd rather mostly stay at home.
If I'm getting tired, I need to go. And not to push myself, you know. The days of pushing yourself kind of gone.
Acute myeloid leukemia is a cancer that starts in the bone marrow. A soft inner part where new blood cells are made. Acute means that the cancer usually comes on quickly and gets worse quickly if it's not treated. Myeloid refers to the type of abnormal white cells build up in the bone marrow. These abnormal cells are called myeloblasts. Myelo means bone marrow in Greek, and blast means immature sprout. Leukemia means cancer starts in the blood, forming cells in the bone marrow. These cancer cells often spill out into the blood that circulates to the body. The risk of AML increases with advancing age. It has been found that acute myeloid leukemia is more common in adults above the age of 65 years old. Incidence of acute myeloid leukemia is higher in men than in women. Patients who have received chemotherapy or radiation for the management of cancer are more prone for developing AML. It has been found that exposure to high levels of radiation may lead to abnormal changes in the bone marrow and trigger the development of AML. Survivors of nuclear reactor accidents may be at risk of developing AML. Patients who suffer from other blood disorders such as myelofibrosis, myelodysplasia, thrombocythemia, or polycythemia vera could be at risk for developing AML. Some chemicals such as benzene can increase the chances of developing AML. However, strict regulation in most countries limit the exposure of such chemicals, which means they play a small part in causing AML. Smoking is associated with more than 15 types of cancers, including leukemia, as cigarettes contain many substances which are harmful to the body. There are also reports on an increased risk of leukemia in children and parents who smoke. The risk of AML is more in patients with genetic diseases such as Down syndrome. The signs and symptoms of acute myeloid leukemia include fever, repeated infection, fatigue, pale skin, difficulty in breathing, pain in the bones, tendency for bruising and unusual bleeding from the nose or gums. AML happens when 6 seed cells in the bone marrow called stem cell fails to mature into healthy blood cell. Instead, the abnormal stem cell gets stuck in early stage development called myeloblasts or blast for short. Having a few blasts in marrow is normal. In healthy people, myeloblasts are where only 1 or 2 or 100 cells in the marrow. AML, these blast cells increase at least 20 out of 100 cells in the marrow or greater than 20%. When abnormal blasts build up in the bone marrow, they crowd out healthy blood cells. As a result, level of healthy white blood cell, red blood cell, and platelets are low. White blood cell fight infection, red blood cell carry oxygen, and platelets prevent bleeding. Blasts can spread into the bloodstream and other parts of the body such as skin, gums, and brain. The presence of too many white cells with a reduced count of red cells and platelets in the blood could be a sign of AML. The presence of immature blast cells, which are normally present in the bone marrow but not in the peripheral blood, can also be considered an indicator of AML. A bone marrow biopsy and aspiration involve the insertion of a thin needle into a long bone of the body to withdraw a small amount of marrow. The sample can be tested in a laboratory to detect any abnormalities linked to AML. Immunophenotyping is a specialized test that is performed on either a blood sample or bone marrow aspirate sample. The patient sample is analyzed through a machine known as flow cytometer, which allows identification of abnormal markers which are present on the surface of white blood cells. Immunophenotyping allows for the detection of blood cancers and aids in the classification of the subtype of the blood cancers. In addition, as the test can detect even small amount of residual disease in the blood or bone marrow, it is used following treatment to assess disease response. Tests of the bone marrow have to confirm the diagnosis of AML. Results of these studies can also be useful for determining how the disease will progress in the future. These tests involve the examination of the chromosomes in the cells of the marrow sample taken during a biopsy. It can help to detect mutation in the chromosome that can affect the functions of the bone marrow and trigger the development of AML. Increasingly, there are several recognized molecular genetic abnormalities in AML cells that are linked to prognosis. Molecular testing provides information on the risk group of AML patients. In addition, monitoring of the level of known mutation in patients often also allow us to measure the response of patients to therapy, even when there may be only very small level of AML disease in the bone marrow. Induction therapy is the first phase of AML treatment. It is aimed at destroying leukemia cells in the bone marrow and blood. However, initial induction may not kill all the leukemia cells. Hence, further treatment is needed to prevent relapse. Phase of AML treatment involves the destruction of the remaining leukemia cells. It is also called maintenance therapy or post-remission therapy. It is considered vital for reducing the risk of relapse. Chemotherapy is a form of induction therapy, although it is sometimes included in the consolidation therapy as well. Chemotherapy involves the use of medication to kill cancer cells. The number of sessions of chemotherapy depends on the extent of AML. Targeted therapy involves the use of drugs such as midostaurin that directly attack specific vulnerabilities of cancer cells. Midostaurin works by inhibiting the action of an enzyme in the cancer cells by preventing their survival. Anti-cancer drugs such as all-trans-retinoic acid and arsenic trioxide can be included in the treatment of a subtype of acute myeloid leukemia, which is known as acute myelocytic leukemia. Not all patients with AML require a stem cell transplantation. However, patients with poor risk AML or those who have not responded well to induction or consolidation chemotherapy will often need to proceed to transplantation if a suitable donor can be identified. A bone marrow transplant is often included in the consolidation phase. A bone marrow transplant is aimed at re-establishing healthy stem cells in the marrow. It involves replacing unhealthy marrow with healthy stem cells to stimulate the regeneration of natural blood cells. High doses of chemotherapy or radiation is given before a bone marrow transplant to destroy abnormal marrow. This is followed by the infusion of healthy stem cells from a compatible donor. Patient receives a diagnosis of AML infiltration of the stomach. AML is a cancer of the blood and bone marrow with excess immature white blood cells. It is the most common acute leukemia in adults, and its incidence increases with age. In adults, the median age at diagnosis is approximately 65 years. Older persons who are unable to withstand chemotherapy have an average survival of 5 to 10 months. Risk factors for developing AML include the presence of other blood disorders such as myelodysplastic syndrome, chemical exposure such as benzene, ionizing radiation, and genetic diseases such as Down syndrome. Patients with AML may present with fever, fatigue, weight loss, loss of appetite, shortness of breath, wound pain, easy bruising, bleeding, and frequent infections. The first clues to the diagnosis of AML are leukocytosis on complete blood cell count and leukemic blast on a peripheral blood smear. Definitive diagnosis requires bone marrow aspiration and biopsy. Examination of the marrow or blood under light microscopy and flow cytometry helps to differentiate AML from other leukemia and classify the subtype. AML commonly presents with extramedullary involvement, including of the liver, spleen, lymph nodes, eyes, gingiva, skin, and central nervous system. Involvement of the digestive tract is rare. The first-line treatment of AML is chemotherapy, which divided into two phases, such as induction and consolidation therapy. The goal of induction therapy is to achieve a complete remission by reducing the number of leukemic cells to an undetectable level, while the goal of post-remission therapy is to eliminate any residual undetectable disease by achieve a cure. For patients with relapsed AML, hematopoietic stem cell transplant or a new chemotherapy regimen is advised.